We've all heard of trauma and traumatic events, but we may not understand exactly what those words mean or how the concept of trauma fits in with the recovery approach to treatment. In this video, we'll look into what trauma is and we'll examine the brain and body response to understand trauma. This video will give you a better understanding of how trauma affects people, particularly individuals with mental illness and substance abuse issues. I'm Dr. Richard Hoefer from the University of Texas at Arlington's School of Social Work. With strong support from the Hogg Foundation for Mental Health, I'm presenting information to help you learn more about recovery and what the concepts of recovery are. The purpose of this training is to advance the goal of the Hogg Foundation Recovery to Practice grant program. We seek to enhance the implementation of recovery-oriented practice among behavioral health practitioners through participation in comprehensive discipline-specific training, including for social workers. This information will be helpful to anyone interested in learning about the recovery approach to improving mental health services, whether they are still students or are experienced practitioners. To better understand trauma, we must first look into how the brain and body react. We can separate the brain into three categories for trauma explanation. The reptilian brain, or brainstem, that provides basic bodily functions. The limbic system, that is instinctive and deals with fear and pleasure. And the neocortex, or cerebral cortex, that provides logic, imagination, planning, and control. This area is more sophisticated but slower than other parts of the brain. When people are in a situation where they feel their survival is threatened, the primitive reptilian and limbic parts of the brain override the slower cortical parts. There are three possible survival responses to perceived danger: fight, flight, or freeze. When danger is sensed, blood and oxygen are diverted to muscles and adrenaline floods the body. When this happens, all systems that are not crucial to survival are switched off and the production of cortisol is enhanced. Cortisol stops people from feeling pain, which helps focus on survival. An example of how this occurs could be to imagine driving a car. The reptilian brain is functioning by keeping the heart beating, lungs operating, and other vital bodily functions going. The limbic system goes into effect when your favorite song comes on the radio and it makes you smile. As you drive, you see a light that has been green for a while, and you wonder if you'll make the light or have to stop. This is the cortex functioning. All of a sudden, your car is hit from the side, a traumatic event. Things seem to slow down, and you brace yourself, holding onto the steering wheel tighter. At this point, your body is in survival mode and adrenaline is flooding your body. Cortisol levels are high and could explain why you are able to walk away from the wreck when your car comes to a stop, but feel considerable pain later. Trauma occurs when someone is overwhelmed by something out of their control. Survival takes over the rational brain. Trauma can lead to post-traumatic stress disorder, PTSD, where symptoms can last at least a month. When trauma happens over and over again, it can become complex PTSD. This can happen from many experiences, including being at war, being a victim of domestic abuse, or after child sex abuse. In these cases, the natural alarm system becomes jammed, memories are stuck and confusing, so triggers can set off alarms. Triggers can be anything: color, smell, sound, or other sensations. Common indicators of trauma include depression, crying, numbness, nightmares, flashbacks, stress, feeling sick, feeling shame or guilt, problems with sex, social isolation, and experiencing triggers. Symptoms of trauma often leave individuals feeling overwhelmed. When this occurs, Self-treatment or self-repair may happen to find short-term relief from symptoms. Self-repair can be taking a nap, eating, using drugs, or many other things. This short-term coping strategy can lead to alcohol and substance abuse problems, self-harm, disassociation. This is where individuals are detached from reality. This detachment can be specific. Someone who is orally abused may avoid going to the dentist even when they are in severe discomfort from a bad tooth. Traumatic bonding can occur. This is also known as Stockholm Syndrome, where victims develop strong feelings of trust and affection for their abuser. When an individual's system goes into survival mode, the part of the brain in charge of retaining memories stops functioning. This makes it hard to remember specific things about the event and can create confusion with jumbled memories that may not make sense. It's important to remember that a person who has experienced trauma can have symptoms that vary often and significantly. They may express one or multiple symptoms at a time, and they may change from one day to the next. In summary, there are four main things to take away from this introduction to trauma. Trauma response is the brain in survival mode. Repeated abuse can make trauma symptoms worse. In response to trauma, people will behave in unexpected ways. Trauma is a normal human response to abnormal events. In the next video, trauma is explained in more depth. You'll learn how the signs of trauma affect mental illness diagnosis and substance use.